Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. So, question number one states a 28-year-old female experiences a sudden throbbing headache with nausea and sensitivity to light. She has a history of migraine attacks, and her nurse practitioner prescribes a medication to treat the current attack. Which of the following medications would be most appropriate for her acute migraine? Is it A, beta blockers, B, triptans, C, amitriptyline, or D, topiramate? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you are answering what is even being asked of you. So here, the stem of the question states, which of the following medications would be most appropriate for her acute migraine? And again, this is the significance of reading the stem of the question. You know nothing else, but the stem tells you everything that you need to answer this question, right? What is the most appropriate treatment for acute migraines? How do we treat acute migraines? What is the first line therapy? Triptans are what we use for acute, aka abortive therapy for migraines, right? So B is your best answer. Question number two. A 45-year-old male suffers from frequent migraines, experiencing attacks about 3 times a week. His nurse practitioner wants to reduce the frequency and severity of his migraines. What is the primary goal of the therapy that will be prescribed for him? Is it A, to provide immediate relief during a migraine attack? B, to reduce the frequency and severity of future migraine attacks? C, to treat symptoms such as nausea and vomiting during a migraine? Or D, to identify and eliminate all migraine triggers? Take a moment and tell me what you got in the comments, you guys. All right, so stem the question here states, what is the primary goal of the therapy that will be prescribed for him? All right, so first off, we need to figure out what we're even providing as treatment, right? And then we can determine what the primary goal is. So we have a 45-year-old male. He has frequent migraines, has attacks about 3 times a week, and the nurse practitioner is wanting to reduce this frequency of his migraines by doing like prophylactic therapy, right? So, what is the primary goal of prophylactic therapy? Prophylactic therapy is typically utilized to reduce the frequency and severity of future migraine attacks, right? We're not worried so much about immediate relief right now because that's more so when you're in an acute abortive state, right? That you need to have the abortive therapy, I should say. So, like question one, when somebody is actively coming in and they're experiencing this migraine right now, then you want to treat with triptans as an acute or abortive therapy. Whereas somebody who is just mentioning that, hey, I know I'm on treatment, but I have frequent attacks. I'm still experiencing these things 3 times a week. You want to put them on something prophylactically as well to reduce the frequency and severity of the future attacks. Okay. So B is your best answer. And then lastly, question number three. A 30-year-old woman has been experiencing dull pressure like pain around her head for the past few months. The pain is often described as a tight band around her forehead and is not associated with nausea or vomiting. Based on these symptoms, what is the most likely diagnosis? Is it A, a migraine headache, B, a tension headache, C, a cluster headache, or D, a sinus headache? Take a moment and tell me what you got. All right, y'all. So The stem of the question here states, based on these symptoms, what is the most likely diagnosis? Y'all know I always tell y'all, if they're asking for a diagnosis, you need to run it back and look at those assessment findings. Look and see how they present. What are their chief complaints? What is noted on exam and assessment by the nurse practitioner, right? So this patient comes in, 30-year-old female. She's experiencing this dull pressure like pain around her head. It's been going on for a few months. And she describes this pain as a tight band around her forehead. She denies any nausea or vomiting. So the key is when they tell you specific key identifiers, you need to know what those are associated. That tight band is a key identifier for tension headaches, right? Remember tension, rubber bands are like you can put tension on those and they have band-like headaches. So the classic presentation for tension headaches are band-like. So if you see band-like headache on any exam, think tension headache, okay? For board's purposes, think tension headache. So B is your best answer. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And you guys, if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. All of the things that I do offer are linked in the bio of this channel, including my website. I always tell you guys to either call, text, or email if you're looking to book any personal sessions, one-on-one sessions, any customized plans. As I did remove that off of my site just simply because I want to make sure that you're booking the appropriate thing. I'm big on identifying what you truly need. And oftentimes, uh, you have studied and if you are unsuccessful, you feel as though, okay, I'm just going to keep studying. I'm going to keep reviewing the same content. I'm going to keep doing this. Oh, Brittany, I did your daily questions and I'm getting them right. I don't know what I'm doing wrong. And that is why I like to speak with you guys. Because if you continue to have these deficits, then there's additional assessments that you need. And I'm big on trying to hear your story, look at your scores, and identify where your gap is so that you can book the appropriate session so that you're not going through this scenario again. Oftentimes, it's not what you're studying, is how you're studying and how you're applying it. And so that's the reason why I always say either call, text, or email so that I can gauge what you truly need to make sure you book in what you is appropriate for where you are on your board preparation journey. Okay. But all right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.